HPV virus is a virus that's very common. Most young people are going to be exposed to it at some point in their sexual lives, and most men and women are going to clear that virus within a year, usually sooner than that. And you can see in this pie chart that HPV is the #1 sexually transmitted infection in terms of incidence. That is new cases. And herpes is the most common in terms of prevalence. The clinical uses for HPV testing are very important to know about. We only test for high-risk subtypes, #1. We don't care about intermediate or low risk at this point in time. And we know that we utilize HPV testing, high-risk subtyping, for ascus, atypical squamous cells of unclear significance. We used to say, don't ask us about ascus, it's a pain in the ascus. But I always tell my patients, don't shave down there. Snip and clip, but don't shave, because you don't want to create microabrasions as portals of entry for sexually transmitted infections to enter. And one of the problems with anal cancer and HPV in the anal area is there is a great opportunity, because the skin doesn't stretch all that well there, for microabrasions to occur and micro cracks to occur for HPV to enter. So hot off the press still, because a lot of clinicians are not aware of them, we start screening at age 21, not at age 18, not 3 years after penile vaginal sex, first sex, but at age 21. And then we repeat every 3 years for women in their 20s. So that's a big change. That's an interval that for some clinicians they feel rather uncomfortable with.